I'd like to talk about how fibromyalgia and chronic fatigue may be related. I'm Dr. Barbara Bruce, and I'm a pain psychologist and the clinical director of the Fibromyalgia Treatment Program at Mayo Clinic in Jacksonville, Florida. You may be wondering why I would talk about fibromyalgia and chronic fatigue as if they were related. That's because recent research suggests that they may be very much related. Researchers and physicians know that the overlap in symptoms between fibromyalgia and chronic fatigue are almost complete. Symptoms of fibromyalgia include chronic widespread pain, severe fatigue, unrefreshed sleep, and often brain fog. Symptoms of chronic fatigue also include severe feelings of exhaustion that's not brought on by exertion and not really relieved by rest. People who have chronic fatigue also experience sleep disruption, brain fog, and often pain. Medical examinations and laboratory studies of people with fibromyalgia and chronic fatigue generally come back normal, and there's no laboratory test to confirm either diagnosis. Multiple specialists may examine you and explain to you that your tests are normal and that they cannot find a medical explanation for your symptoms. That happens over and over again in people with fibromyalgia and chronic fatigue. The pain and sensations that people experience are very real, but the usual causes of pain, tissue or nerve damage, are not occurring. And yet you continue to feel increasingly ill and unable to engage in your life as before. Something is wrong, and you know it, but doctors do not seem to understand what's wrong. Scientists are learning about a potential underlying central nervous system mechanism that may explain both fibromyalgia and chronic fatigue. It's called central sensitization. Central sensitization describes an alteration in the central nervous system that leads to the amplification of pain and other sensory phenomena. In central sensitization, the brain is in a persistent state of heightened reactivity, not just to pain or to exertion, but also to light, sound, odors, food, touch, and even medication. Central sensitization is thought to play a role in many different chronic disorders, including whiplash injuries, chronic tension headache, migraine headache, irritable bowel syndrome, chronic fatigue syndrome, postural orthostatic tachycardia syndrome, complex regional pain syndrome, interstitial cystitis, temporal mandibular joint pain, and other regional pain syndromes, especially back and neck pain. The good news is that several tools and strategies can turn down central sensitization. If we can decrease symptoms of pain, fatigue, sleep disturbance, and brain fog, we can also turn down the other physical symptoms, including the bowel symptoms of IBS and the symptoms of interstitial cystitis and headache, for example. Anything that can soothe or quiet the central nervous system can impact central sensitization and help you to feel better, and most importantly, live better. Return to your life, return to your loved ones and the activities that you enjoy. You'll learn all about these tools and strategies and how to start using them in your life today in the Fibromyalgia Treatment Program. Thank you.